library, two-part library. My library and Dr. Kamal is in her own office in her library. I can see the books in the background. So it's athlete and nerds all together rolled into one today. Pretty excited about this. So when we're talking to Dr. K, Dr. Kamal today, you're going to find out she's a physician and a scientist, a mother, administrator, athlete, all around badass with the brain and on the lifting platform. So she hails from New York. She's now a professor at the University of Missouri, ran cross country in high school. So there's the athlete piece. Now she does powerlifting on the side, hoping to make it to worlds. The big deal here, we're going to talk about the brain today and how that impacts athletes. Specifically, she has expertise in epilepsy, concussions, all sorts of problems that people have, migraines, and she's on the board with the NFL. She's at this year's Super Bowl with the Brain Health Summit. Chad Coy, who was one of our guests on the show a little while back, recommended we speak with her. This is our second neurologist. If you listen to Zach Riley, he's the two-time All-American thrower that we had on from Indiana University. But now we have Missouri, and we have Dr. Komal in today. Hey, Doc, thanks for coming in today. Thanks for talking to us. Welcome to the show.
Thank you, Jim. Really appreciate that. And that was a very generous introduction. I appreciate all of that. So thank you. And I'm not quite on the NFL board. I was asked to speak at the Brain Health Summit at the Lee Steinberg Brain Health part of the Steinberg Party. So, but thank you for that. And it's a great time. I'm looking forward to with you.
Awesome. So I'm going to have some athlete questions and some brain questions and how they intertwine. Let's talk about you as an athlete first, right? So cross country endurance athlete at a younger age, now it's powerlifting. That's static, right? Just sitting there, 3 lifts times three, nine attempts, not much running, nothing that cardio there. So how does one go from one end of the spectrum to the other?
Yeah, so in my brain world, my neurology world, I'm a subspecialist. I love the being disciplined in just a couple areas. But as an athlete, I love the well-roundedness. I want to be able to play a pickup game of ultimate frisbee or swim a half mile under time. So I really kind of wanted to be the full range of what fitness can look like. So I did run cross country in high school. Probably didn't come from a background of athletes well enough to fuel right, build those foundations on what I could do and leverage potential as an athlete. And that kind of came more later in life with I think just the key areas of discipline, accountability, a good coach. And so through that journey, I learned that strength is something that I love doing, love pushing some weight around. And it was something that was unique. You don't see many 4'11" and a half middle-aged Indian backgrounded women walking around lifting heavy things. And so it became part of my personal branding. It definitely gives me some street cred in with the athletes that I take care of professionally. But yeah, I love that. I love the strength sports, and then I also actually do sprint triathlons too. But as I've become a little bit more competitive in the powerlifting world, and I made some poor pull-up decisions and tore a little bit of my labrum, so I took a break on the triathlons. But I do sprint triathlons too. They're polar opposites, kind of speaking to
Mm-hmm.
that full range of athleticism that I really value.
Gotcha. Well, just from perspective or some reference points for listeners, she's roughly a 2 times body weight squat, more than 2.5 times body weight deadlift, 1 times body weight bench. That with the endurance piece, it sounds like CrossFit might be a pretty good fit then because that's a little bit of everything. So have you dabbled there also?
I was part of a box a few years ago, but not so much. I've done the open CrossFit workouts probably 3 or 4 years, and you know, I feel like um, I've learned a lot about myself on the powerlifting platform. I'm not really an anxious person, but when I first stepped onto the powerlifting platform in front of people and judges in my space, I was like, whoa, this is a whole level of panic I've never felt before. And so, I've gotten to actually grow through the competition aspect of things too. The open CrossFit, um, you're I'm not competing at that level
Hmm.
yet, or ever. So, you know, I think for a good workout of the day, I my CrossFit workouts are my go-to if I was doing it on my own.
Sure. Gotcha. So just some basic questions. I have some my own thoughts and my much lower level education on this, but since you're, our brain doctor here today, for lack of a better term, talk about working out and how that impacts the brain, and also talk about training. So working out in my mind is you want to be well rounded. You're going to do something at the gym, but you're not that intense. Training is more purposeful. You have some end goals in mind. Talk about working out and training and how that impacts the brain.
Yeah, I mean, we know that all of your body benefits from working out. Your glucose levels, your cardiovascular system, so heart and brain vascular systems. We know musculoskeletally, your bone density, osteoporosis, osteopenia, but also the brain being an end organ definitely benefits. Better use of the metabolism that is happening, creatine and ATP, and all of the production of chemicals. Um, you have natural surges of serotonin. You also sleep better. So all of those chemicals that are released and regulated in a cyclical way definitely is metabolized better with a good workout. We know that uh, it is now part of evidence-based practice for people that are suffering from cognitive disorders like dementia, and Parkinson's, to make sure that they get at least 3 to 4 days of conditioning or cardio a week. And so there are a lot of benefits physiologically, and that doesn't even include the psychological benefits that come from working out. The aspects of resilience and combating a chronic medical condition like a neurologic disorder, like epilepsy, for example, really helps with the psychological aspect. When you're working out, you're constantly learning new skills. And so that allows the brain to network and re network and strengthen areas. When I see my athletes, I talk about um, problem solving and I talk about multitasking. And a lot of my teenage athletes are like, well, I don't do that well anyway. And I'm like, you're an athlete. You do that. You think about the play, you catch the ball, you run, you have visual, spatial, proprioception all working together. And so when you're working out, you're learning a new skill, you're adapting your body, you're working on your balance, and all of those things together really help the brain.
Gotcha. We had another lady on, Christy Fulmer. She's a Hall of Famer boxer in Indiana, and she helped start Rocksteady Boxing. And so that whole franchise works with mostly with people with Parkinson's and helps them to continue to be active and build some strength and build some conditioning and help them handle a mental affliction and handle it better and a better quality of life. So we've heard it from a number of folks, and just I can tell you some days when I'm stressed out, some days when I'm not in a good mood, when I'm upset, and I just do a basic workout, hit the minimums, I feel better. If I go for a run or I lift heavy, I feel better. And then if I could grease the groove and get going and then add onto that workout later, that same session, I'm like, okay, I took this adversity and turned it around and then got a win. So I can be having some challenges and some losses personally, professionally, and then I turn it around physically, then I could change my mood and then go back to those issues I was having personally and professionally with a clearer mind and it may be a different perspective. One, probably because I calm down, I'm not pissed off or upset anymore. And that can maybe just handle the challenges just a little bit better, or at least get some wins so I feel good about how the day's going to end.
Yeah, absolutely. And I think too, it and this is kind of a deviation from your question, your exact question, but it really helps with time management too. I feel like my day is more
Mm.
organized, more planned out when I start the day with a workout. I don't. Much more structured. And so I think it's really important to structure your day around a workout so that you are more centered, more focused, especially when you're optimizing that time that you're actually trying to be productive. So
You mentioned that I always send out questions beforehand, and on the mindset piece, your first thing you put in there was make time. Make time for because people can, and I'm guilty of this too. I let other things, less important priorities, become a big priority, and then some things that I really wanted to do, I didn't get to because I lacked some discipline. So if you can get some things out of the way early, like your workout or your top two business goals that day, you're already setting yourself up for some wins. And I know for me, others they can train at night and that's fine. For me, it can get away from me, and I have kids, and thankfully they're a little bit older now, so I don't have that piece with taking them to practices. But those evenings can get away from you, or you get stuck at work, or you come home and you're just tired, and now you don't really want to as much. A lot of times I get to the gym before I'm sometimes even totally awake. I'm like, well, I'm already here. I kind of, I don't have time to negotiate with myself. I'm already here, and now it's happening. So you're right. I love starting off in the morning.
yeah, I think the piece too that's important because I have a lot of residents and learners that ask me like, "Hey, you're so busy, you do this and that. How do you make time?" And so, I think that what you said about whether it's a 20-minute workout or whether it's a 10-minute workout, you can do
Mm.
something. And I think oftentimes too many people wait until they're like, okay, when I have that time in my life that I can block off an hour and a half, then I'll start. But really, it's a
Mm.
progression. So once you make it part of your daily life, like for me, I wake up about 5:30, do some home things that I need to do, especially like knock out some work in the morning if I can, emails, things like that. Kids get up at 6:40, get them ready for school, and then we're out the door by usually 7:30, 7:35. Um, Drop them off because the school doesn't open until 7:30, and then I make it to my gym by 8 o'clock, 8:05. My coach might say 8:10,
Hmm.
and then I do my workout and plan my day after that at work. But yeah, if it's an afternoon workout, I may or may not make it. I may be much later, and it doesn't have to start out with 4 days a week, 1 hour sessions at the same time, all at one time. I think the real thing is just chipping away at it.
It
So
really is. I was talking to one of my athletes this morning. He's an MMA guy, and we're talking about um, process all the time, process all the time, process. And he had some losses on Monday and Tuesday last week, and then didn't train the rest of the week. And I'm like, hey, that's not it, pal. Like you got to turn those losses around. Like you can. And he's an MMA guy. I'm like, hey, if you get knocked down, you have to get back up soon. There's a time component. And if you have a loss on Tuesday and you don't turn it back around to the following Tuesday, you have 7 days of not of easy wins you can get in. Just getting back in the gym and get a good discussion. And he agreed, hey, when you're taking a loss, uh, stop that momentum and just something easy to do that is a walk or a hike. But then you start adding some intensity to it, then it's even more impactful. One of the things you noted on this questionnaire was on the mindset compete every day. So there's for some, starting out working out is a competition. Going from 2 days a week to three, they're competing with themselves mentally and they're getting better. Dealing with higher level athletes, there's a standard, right? You're not missing practice. You're not missing the weight room. You have to be there with the coaches. Talk about competing every day. What's that mean for you? And how do you build that? Because you said everything's a progression.
Yeah, I'm extremely competitive, and I have to say that compete every day is not mine. There's a company, it's compete every day. They have great, a great t-shirt as well. So squat heavy, and really, I think that it it matches and aligns with like my mo, because I'm always competing with myself, just wanting to be better, do better. One of my previous coaches was like, you don't have to be balls to the wall all the time and every day, and I'm like, I don't know much different than that. And so whether it's work, or whether it's parenting, or whether it's working out, I feel like you can be better every day. And that doesn't mean that you're always winning, like you said.
Hmm.
I think that it's just an effort really related thing. Are you giving your maximal effort for yourself, and not, and so um, times, situations, things like that can change. And so for me, that progression is, for that day, am I just trying to be give my maximal effort in whatever I'm doing? And I think that that's also helped me to be present in whatever I'm doing. So if I'm working, I want to take the best care I can of the patient that's in front of me. If I'm on a business venture, wanting to do that as informed and as best as I can be. If I'm working out, wanting to try to be fully present and give maximal effort there. So, and I think that what you were talking about before, Jim, about, if you fall down or you get hurt, it's not a loss. Really, competing every day also means reflecting on those things that you didn't get perfect the first time, and troubleshooting, pivoting, and just making that better the next time. So I just did a powerlifting meet on Friday. It was national championships. And while I don't think I got like the highest dot score that I've ever gotten, is probably on par with my previous dot scores, um, but not higher. I still checked some of the key boxes that I wanted to, which was make sure that my day before and my day of nutrition was better, that I didn't get psyched out, have my usual like platform anxiety, um, and that I checked those boxes, and to me that was a successful competition. Set some state records and a national record as well, but all of that came secondary to the real metrics and goals I had for myself, which is get my nutrition better for competition day, and then not get so in my head to compete. And so, I think that those are manifestations of the philosophy of competing every day.
Mm. You know, everyone has like the tangible goals. I want to play at this level. I want to make it to the NBA. I want to make it to college, or I want to get a scholarship, or some just make varsity. And for some, they just want to get on the field or the court. When you're competing all the time and you have those directional targets, those are great. But I think what is most impactful, and I harp on this all the time, and you just highlighted it and made it easy for me, was all your targets and goals were all procedural, all process, all the inputs. So if I can have this nutrition done well, and I have my sleep diet dialed in, and if I can go through my process to control my anxiety and keep my energy from burning off, then you give yourself the chance standing on a platform to go through your progression and your process once you have the barbell in your hand, right? So it all comes down to the process. And so when you do get knocked down, or you go on a big bender weekend and you got wrecked and ate a bunch of food and you got drunk, well, what's your process on Monday? Or what's your process for this meet? What's your process in the moment? So I think that if the athletes take anything from the show, or people from the show, if you can have more process oriented goals, one, you're gonna be a lot happier, because the meet doesn't happen every day, right? You're not on the platform tomorrow competing, right? So, well, you're not going to be happy until the next time you're on the platform. No, but if I have these process goals Monday through Sunday, and I hit those all the time, I'm feeling pretty good about myself, building confidence. How can I compete the next Monday through Sunday? And now, if you're doing that, now you're setting yourself up. You're doing all the inputs to lead to that output, to lead to that national record that you set. That's the hugest
Well,
takeaway.
I definitely agree with that 100%. In fact, all of my main focus areas and love for research or scientific work is all quality improvement um, projects. So optimizing those processes are super important because I think too, if you think about it, and any athlete would probably understand this too, is that there's so much about the final outcome that's not really in your control. Really, what's in your control is your methodology, your process, your strategy. And if you can optimize that process, then I think that you can be proud of, you can be pleased, proud, and feel like you really competed despite what the outcome might be. So, yeah, definitely agree with that.
You're right about I'm guilty of this, and everybody is, where you walk on the court or the field and it's not the same conditions. I'll see just locals at a powerlifting meet, which isn't the pro level, and they're complaining that that's not an Alico bar, or it's not, it's they don't like this judge, or the lighting was bad. I'm like, well, you can play soccer on the field and it rains, right? You can play golf and it rains and you still got to play, right? So things happen that are out of your control, and you'll see some like people that run track and they're not used to bad weather, and then they're in Oregon for nationals. The next thing you know, it's raining or it's windy, and they don't know how to handle it. Then they break. I'm like, well, everybody else has the same track that they're running on. What I loved about Tiger Woods, well, a lot of things, but one of the things was that he would specifically play in the rain. What's my grip feel like? What's the rain gear? So he has all these contingencies for all these issues, so that when he's hit with adversity, he has a process. He has a plan for it. So yeah, you can keep controlling your inputs. You give yourself a shot because things happen. You can show up and do your best and still get beat. You can show up and do your best and get cheated. Like that shit happens. There's bad calls, right? You just focus on your process. Otherwise, you're like me. You just be miserable when you're focused on something else. So for when you're highly intelligent person in your area and you said, "Hey, I'm in my head," and I'm like, "Well, you're a head doctor, so how do you recognize that and be like, hey, how did you come up with your approach to not being in your head and calming down in the adversity of competing?"
I think logically thinking about the steps has helped me to not be in my
Mm-hmm.
head. To recognize that, you can only control two things, and that's your effort and your
Attitude.
yeah, and your mood. Basically your effort and your outlook are the things that you can control. And I think that when you get in your head, I think way too many people sometimes reach for an immediate, tangible solution like a medication or something like that, or blaming someone or something. And there's definitely a role for that sometimes. I am a medical doctor, so there is definitely time for that. But I think that all too often people aren't necessarily reflecting on well, what is it that's making me feel like this, and let me logically think through um, what can I do, what is the evidence, what is the data, what is the information that I have to know that I don't have to be in my head anymore. Like, did I do this? Yes. Am I doing this? Yes. Am I is this something I could work on? Yes. But I think that being true and honest and transparent with yourself, reflecting on what you really truly are excelling at and what maybe are areas of opportunity for growth, and then logically coming up with a plan and optimizing that process is really kind of how I get out of my
Mm,
head. um, it becomes a little harder when I can't come up with a
sure.
plan, and just like, I guess I'll just go with it. But there's times like that too.
Well, confidence comes from reps, and you do 50 meets, you're going to be a lot more confident after you do your first meet. But being in your head for me is, it's a feeling, it's an emotion. So let's
Right.
look a little deeper. Was the concern that you're going to get hurt, squat, bench, deadlift, or was it concern that you might look or appear a certain way and your ego was on display? Which was that for you?
Yeah, so for me, it was definitely the imposter. Like, I don't know if I feel like I belong
Mm.
here. But you're right. It's in the reps, it's in the repetition. And my coach will say, this is what you've done all the time.
Hmm.
Like, you've done all the time. But for me, to, since I am competitive and performance driven, I want just to know that I'm better than what like. It's been always a frustration. I have never PR'd at a
Hmm.
meet. I have always only PR'd in training, and then I get to the platform and it's like sub threshold what I can do,
Sure.
and I'm like, what is that? I don't understand it, and it's frustrating to me. But it's also trying to convince myself and everybody else that someone who fits my stature and my ethnicity and my age, all of that, my size, that I belong there. So definitely an ego thing. I see it when I'm trying to like, lift a bag up when I'm traveling into the overhead compartments, and someone's like, "Ma'am, can I get that for you?" And I'm like, "No, you shouldn't. I can do it myself." But so it was definitely an ego thing.
Gotcha. Gotcha. You know, uh, when you PR, it's usually a controlled environment. I'm at my home gym, my coach is there, I'm used to the spotting, we move up in a nice, timely fashion, and you're typically not maxing out all three main lifts, which wreck your nervous system, right? So, doing all three the same day at a different venue with people that are staring. There's people within a few feet of you. There's many people. There's spotters, the loaders, and the judges. Then there's lights, and then they're live like ours at our meet we live stream, so people are watching in from a whole bunch of places. Then there's people, and you could get in your head about how I don't want to let my wife down or my husband down or my kids are here or people from my gym are here. You want to perform or you know I don't want to take last. And there's all that does is take your focus on something extraneous and not, hey, I'm benching. What's my process? My coach made the call. I'm looking at the bar. I'm controlling my breathing. Where's my grip? Where's my setup? Right. So when you just control your focus on the process, again, I think all the anxiety goes away, but you have to like, train yourself. So a very stressful environment at home, in the home gym, if your coach can simulate that so that you're used to that, and you're like, oh man, it's just you versus you. And when you set your wins at, hey, I got these things right, these markers, these inputs right, that's the win for that day and that event. Do you want to win the whole thing? Hell yeah, you do. Do you want to smash everybody? Yeah, step on their throats and win. Absolutely. But what you don't want is to be the person that didn't follow their process and let their emotions run them. You got to be stronger than your feelings, right? And that's the real trick, using your brain and logic versus your feelings, which isn't in there. So that is a tough one.
Yeah.
Um, talk about what um, you said how your brain can learn new things. We talked about this a little bit before the show started. So one of the things that I implore parents and travel coaches and high school coaches, there's so much specialization at an earlier age. So talk about an athlete that plays travel baseball, but then adds a completely different sport. Maybe it's tennis, maybe it's wrestling, maybe it's basketball, something completely different. Talk about how a second sport, what that does neurologically, and how that impacts the primary sport, if you could.
I think it complements each other. I think that you learn to develop new skills, and I think that that is important for the brain. That whole can't teach a dog an old dog new tricks thing, I don't feel is valid at all. I think that if you try and train and you try again and train and troubleshoot and stay committed, I think you really can learn new skills. And we see that in the brain using functional MRIs or seeing what early epilepsy surgery can do when you're taking out someone's temporal lobe or you're taking out an area of the brain or modulating it with a device to help seizures stop so that the brain can actually re-network. We know that people, after they've had a stroke and an area of the brain has died, their speech, their language, their motor skills, their sensation, they can truly re-network, and we call that plasticity. So the brain has plasticity where it can learn new tricks, and the only way it's going to learn that is unlike Keanu Reeves in The Matrix, where it just gets downloaded and he knows it. We actually have to try, and we actually have to do those reps and those repetitions. And I think that if it's a thoughtful second sport, or if it's a thoughtful methodology for rehabilitation, or thoughtful, accessory work, even if you don't want to commit to another whole sport, you can do things that complement each other so that you're more effective in your sport. So for me, for example, just sticking to powerlifting, when my coach started adding in dynamic work, I saw that my strength actually got better, and my total raw numbers actually went up because I was working through some of those troublesome areas. But one might not think, oh, I have to do dynamic work, speed work to be able to lift heavier, and it works. And so I think that whether it's a sport that has a lot of hand-eye coordination, but then you work on your endurance and your agility and your multi-directional speed, whatever it is, I think you're complementing yourself and each other and the skills that you have to be a more holistic, uh, well-rounded athlete.
So it's safe to say that if you play a separate sport, neurologically, you'll develop these, I don't want to say this incorrectly, these new pathways in your head. So you have a different way of connecting the dots, which may enable you to maybe jump, throw, run a little more athletically. You might learn, so people that are in the pool, they're not on their feet doing much. So you have them doing a sport outside the pool, it's a whole different ball game. So a whole different sport develops these neural pathways, which helps you connect the dots and then move a little bit differently so that when your main sport comes back around, you're a little bit more athletic. Is that safe to say?
Yeah, I think so. And I think pretty much just highlighted movement. But if you think about the executive functioning, the frontal lobe work that comes from learning a sport, right? So what does the frontal lobe do? It's executive functioning, making decisions, planning, multitasking, problem solving. All those components are super important for any sport.
Mm-hmm.
Strategizing, motivation, emotional regulation. All of those things are all frontal lobe things, and you need that for any sport that you play. And so that comes and can be added on to buy any additional skill set that you learn, and I think would only make you a stronger athlete in even just one area.
Love it. Love it. One of my favorite books, and I tout it all the time, is Atomic Habits. James Clear talks about ways to build new habits that you want or destroy habits that you want to get rid of. And can you talk about the little tips and tricks you might want to do? Because you said, hey, you might not want to train some days. You might not want to work really hard on your homework, right? You want to build that resilience. You want to build that competitiveness. Well, everything's a progression, like you said. So what if, how does that work in my head where if I went from working out 3 days a week for a year to 4 days a week for a year, how does that habit building work? Explain to me how I can be better at building habits I want to have or knocking away habits I don't want to have any longer.
Yeah, I think that we are wired to be incentivized, to be driven by what do we get out of it, unfortunately, for some people. So whether you have to find your why,
Mm-hmm.
I think, to be able to build that habit. Just because somebody told you to do something, I don't think works that well. I think building the why, outlining it, going back to that kind of logic of well, why do I want to transition from 3 to 4? What am I gaining from
Hmm.
it? Whether it's just, another day with your community, or hey, my coach is going to be there waiting for me, or I just, even though I'm like kind of lazy and I don't want to go, but I really do feel good after that, then whatever the why is, I think helps to build a habit. I see it with my kids when they're trying to break habits. Like, well, why should I do this? Well, here are the negative consequences that come with the habit that you have currently. So let's incentivize you for a little bit to help build this habit or destroy this other one. And then it becomes this self-fulfilling prophecy, I think, where you build a habit, you see, and actually I did a study supported by Chad, actually, and his team, and it was looking at what regular coach-led strength and conditioning exercise does to burnout. So we did a study for 3 months, 3 days a week of coach-led small group strength and conditioning, and what I think we saw, and what even anecdotally, personally, I saw is to try to establish a routine. You kind of drag your feet a little bit and you're like, I don't really have time for this. This stinks. I'm not seeing results. I'm uncomfortable. But then you find that incentive. For example, in this burnout study, people are like, well, I've committed to this study. I've got to do it. So they keep on doing it. Then you start seeing results, and then it becomes this self-fulfilling prophecy where you are able to establish it as a routine, establish it as a pattern, because you've trusted the process and you are going along with it. You've built your habit. So I think that finding the why and really digging deep to see what kind of consequences, good or bad, are coming from that habit, I think is important to make it a self-sustaining process.
That's huge. From a coaching standpoint, the why is going to be almost everything. So you can tie it back into, hey Jim, you want to earn a scholarship. This is why we're doing these things. You want to get on the field. This is why we're doing these things. This is why you need, or hey, you're not physical enough in football because you don't have the strength or power or speed. So this is why we're doing these things, because you're getting knocked around. So you can train if you can connect the dots from this activity to the result that we're trying to get, whether it's a tangible result of how you perform or how the overall team performs. So you can connect that why. So it's with part of their identity with them personally, but also the identity of the overall team if a team sport. And if you have to kind of like not sell them, but tell them if you do this, then this should happen. And then when it does start to happen, like you said, there's like that confidence is built not only in what you're doing, but hey, what my coach tells me to do is true. Because if you're like, man, I don't think I need speed work, I just need to lift heavy all the time. Well, shoot, he said I should do some speed work, and I did. My numbers and my total went up. Okay, maybe there's something to this, and maybe there's something to my coach, right? So you build that confidence there. Um, if it doesn't happen, the opposite occurs, right? I've been doing all this shit and I'm getting worse. Well, that's bullshit. I don't trust my coach anymore, or I don't trust my process anymore, or I'm doing these things. So you're either building it up or building it down, that connectivity piece with your why, and it's what pushes people or doesn't. When I find an athlete who basically has no why, well, I'm just here because I have to be, you can tell right away that won't be sustainable at all, right?
Yeah, absolutely. And I think that I've kind of gotten used to, again, being like a one lane doctor for so long. I've gotten used to the concept of there are just things I don't know that I don't
Mm-hmm.
know. And so sometimes if I'm asked to do something in the gym, for example, I might not understand why, but that's okay because there are things I don't know that I don't know. And so I'm just going to trust the process and ultimately know that my why is to be more fit, to be stronger, to have enjoy what I'm doing in my sport. And so I think the big picture why is also important. And I try to teach my learners that too. You don't have to like micro analyze all the little steps. Well, why do I have to, have this rotation and that rotation? And why do I have to learn this stupid fact for a test instead of this? It's just, it doesn't matter. You just need to do
Mm-hmm.
it sometimes. Your overall why is to become is to be a more educated physician, to care for people better, to be a better athlete, to to help other people down the road. Whatever your why is, the big picture why is important, I think, to
Yeah.
remember.
If the athlete can then add this piece that I think it really separates them from others, if they see what their performance is and it's not what they want yet or what it could be, then they have to relentlessly look. Why is this happening? What are my inputs that need to change to impact the overall end result? And it's going to take you and an outside perspective from your teammates and your coaches to say, hey, here's what's going on. This is where you're screwing up, right? And that it's that obsessive hunt for those weaknesses and bringing that up that gives that athlete the best chance to maximize, what they can do. It takes a humble athlete because I don't want to hear how bad I suck in some areas, right? No one wants to hear that shit, right? Hey, you would be better off, Jim, if your eating was dialed in even more and you cut out any kind of bourbon or alcohol, right? If you cut all of it out, then you would be better. And it's like, well, shit, man, I don't feel like doing all the things, but that's still the answer, right? Um, talk about how that ego can get in the way, but also help, push. It makes you competitive, so you're working hard and you're trying to win, but it also can hold you back. Talk about building that up and down and how that impacts athletes.
I think that there's a right, and I'm an educator in my role here at the University of Missouri as well. And so I think that how you offer feedback is extremely
Mm,
important. You can build somebody's ego up at the same time as giving them constructive criticism or feedback.
mm-hmm.
And I try to do that with my kids as well. And I think that that's important because it establishes credibility as a coach or as an athlete, or sorry, as a coach or as an educator or as a parent, even when you can not accomplish accomplish the protecting of someone's ego and accomplish their own desire to be better at something without feeling like they're a complete disappointment, right? Because nobody, I don't think, not many people feed off of or desire to excel if they are not, if their confidence hasn't been built to start with. So no opportunities for growth, or hey, I have some feedback, and then I ask for feedback as well in any of those roles. So it can be a bi-directional um, conversation as well. I think helps with protecting someone's ego, but allowing them to have buy-in on this is an area that you probably need to look at, reflect on, and be better about. So
All right, I got like three or four quick ones here. You're a hard charger. There's got to be countless hours when you were studying. There's it's a meat grinder getting through a medical program, right? So then you add kids and you're working out. So talk about lack of sleep, what that does to the brain, short term and long term. Let's talk about that one first.
yeah. So the people that know me are probably going to be like, she's a hypocrite. She's a hypocrite. For all of those that are watching and listening that know me, I am disarming you of that already. I know. So I know I personally need to be better about this. We know medically that sleep is when memory consolidation happens. And so chemicals are being produced in the brain to retain information, to learn, to grow. We know that in the post concussive world, so I do concussion work, that sleep is super important for brain recovery and brain health. So, in addition to now the evidence based practice for dementia, or memory loss is really taking a deep dive into someone's sleep. We also know that sleep has this really interesting paradoxical um, relationship with a lot of neurologic conditions and wellness and health in general. So you have poorly controlled diabetes, you're not going to sleep well. And then that becomes a cycle. You don't sleep well, your diabetes gets harder to control, your blood pressure gets harder to control, your weight, your seizures, your headaches, all of those things. So, this very back and forth paradoxical relationship with sleep. So, yes, I have learned to function on very little sleep. I'm sure that I would be a much more effective person in all my fields if I got like 7 to 8 hours of sleep. But you know, I I I already think that they're 26 hours in the day, and so it's definitely a balance. Now, before a competition, I try to be a lot more intentional about sleep. But as kind of a little aside, uh, situations can definitely affect your sleep too. And for insomnia, which is one of the most common conditions that people suffer from, I the evidence-based and gold standard treatment is cognitive behavioral therapy for insomnia. So, not trying to hide my head under the rug, I tried to find someone to do cognitive behavioral therapy for insomnia on me. And the first question that she asked was, "Are you a physician that takes calls?" And I was like, "Yes." And she was like, "Yeah, what I have to offer is not going to be any good, like anything good for you. Like that you're hopeless, basically." And I was like, "Oh, that's bad." So magnesium glycinate for days that I need better sleep has helped, and an elite sleep pack when I really need it. But definitely, sleep is important. I can be better and should be better.
Gotcha. A couple quick ones right off the bat. I tell people have their room as cold as possible, have some white noise, get off their phones or watch TV an hour before they go to bed. Don't drink a bunch of water so you're up going to the bathroom. Keep your room as dark as possible. Try to read, meditate, or pray before you go to bed. You do those things, you can improve your sleep patterns a little bit. Try to go to bed at the same time so you're not self-imposing jet lag on yourself, messing your world up. But those athletes that travel, that's kind of like part of the deal. But yeah, the to a T, every athlete coach I've had on, they talk about how sleep is basically the number one steroid out there.
Yeah, and sleep. So I'm big about sleep hygiene are all the things that you just described. Working out if possible earlier in the day so you don't have those surges of adrenaline right before bed. Doing something relaxing before bed. Trying to avoid screen time. I'm really big on not doing anything besides sleep and being intimate in
Mm,
bed. So, not watching TV, not reading, not playing cards, not just hanging out like you really should. Have a separate chair for that or a separate place that you hang out for those things. And then you move to your bed just for sleep. And trying not to do those scrolls on your social media feeds right before bed, too.
gotcha. How about booze and weed? Booze and weed. Talk about
Yeah,
that in the brain and for athletes.
super super important to talk about. People think that booze especially helps people to sleep. Well, it actually, what it does is it shortens your sleep latency. So it makes you fall asleep faster, but increases your sleep fragmentation. So you wake up more. And even if it's not just a pee, you pass out. So that's your shortened sleep latency, but you will have a much more interrupted sleep, not just because you're dehydrated and you're dehydrating yourself when you pee at night and wake up to go to the bathroom, but that's just what happens to sleep cycles, and it's really important to try to cycle through all of those um, stages of sleep to really feel refreshed. And what booze does is it shortens key cycles in your sleep, and so you wake up a lot easier. So definitely booze sleep fragments, causes sleep fragmentation. and weed. So it depends a lot on the strain. If people use weed as an anxiolytic or to break up anxiety, that can help sometimes or promote sleep. It's definitely, though, very strain dependent. It's very quality dependent. It's definitely important to consider what other effects it's having, like, for example, if you're smoking it versus using a gummy. But I think that there's probably more evidence for the usefulness of CBD products and sleep versus, as a more natural way of going to sleep.
All right, let's talk about food and sugar. And you mentioned diabetes in the brain and all. So talk about how your diet's going to affect your brain, which will affect you as an athlete.
Yeah, so just like what your coach and your nutritionist recommend is not overloading at any one time, and there's definitely, I think, place for, you know, for me, intermittent fasting did not work for my schedule, but for some people, it definitely can be effective. I think the key is really focusing on a protein, carb mix, and carbs are not bad, but it's really important to have them to fuel your workout. Um, Good clean sugars, are necessary sometimes. Fat is important sometimes to carry the protein and carbs to where they need to go. So really, balance is important. You want to try to stay away from the yucky sugars or the super unhealthy carbs. You really want to do it, and the unhealthy fats. You want to do it in a way that supports your activity level, and doesn't distract from sleep as well. So if you're having like a high heavy meal right before you go to bed and you have reflux, like, it's going to affect your sleep.
Hmm.
Um, if you're having an alcoholic beverage that has a lot of sugar in it, you're going to interrupt your sleep and have this high surge of sugar right before bed. So it is really important to time your food as well, along with your activities.
Gotcha. All right, so let's switch gears. In sports, everyone, football gets the big attention on concussions, but it happens in soccer, happens in baseball, happens in basketball, any of the field sports where there's collisions, lacrosse, right? And then the fighting sports, MMA, things like that for sure. So just baseline for listeners, what exactly is a concussion?
Yeah, so I'll also add to what you said and say, the court sports, basketball, I see
Hmm.
cheer, it's really huge. It's not just the flyers, it's actually the base people that get concussed as well. So, I even have a track athlete who's gotten concussed fell on a rainy track. It really can happen in the pugilistics, like the fighting sports or the collision sports, and really in any arena. But so, what is a concussion? A concussion is what we would define as a mild to moderate traumatic brain injury with symptoms. So, people can get bumped in the head, have a mild injury, but not have symptoms, and that would not be a concussion. A concussion is what data or literature describes seven different what we call trajectories. I think five on one hand is easier to remember. So I always talk about and ask about sleep, mental health, cognitive health, so memory, processing, retention, focus, multitasking, problem solving, judgment, those kinds of things. Um, Pain, so neck pain, head pain, and then movement. So whether it's eye movement, whether it's balance, coordination, hand-eye coordination, proprioception, or knowing where your body is in space, all of those are different signs and symptoms of concussion. And we have a saying in the concussion world that if you've seen one concussion, you've seen one concussion. So it's very possible to not have the same symptoms and this say for football, you have a head to head collision, people are forehead to forehead. It's very possible that both people have completely different symptoms. It's also very possible that someone has a much more minor injury than that, hits their head on the cabinet, or gets tripped up on a dog leash and falls and hits their head shoulder first and then the head is second. It's very possible to have different signs and symptoms of concussion or head injury. But then we back that up to a mild or moderate. So any sort of head injury can have symptoms, and that would be a concussion. Mild to moderate is dependent on, you know, if there's blood on the brain, is surgery needed, how long was the hospitalization, was there loss of consciousness, what were the immediate symptoms, are you amnestic or forgetful of something after the head injury. So that really is the parsing out of of what the definition of concussion is.
Vomiting immediately also could be a challenge, right?
It can be, and some of that is because of the elevated intracranial pressure. Most experts in the concussion world would say there's a three vomit rule. So you're allowed to vomit three times, and then and one vomit might take you to the emergency room. You probably will get scanned as a result of that. And I'll be honest with you, as a mom of two and still being a concussion person and a concussion neurologist, if my kid got hit in the head and vomited once or twice, I'd be like, we're going to the ER. So, the three vomit rule is hard, but I think the same workup would happen. I think that really just corresponds to when in literature we see that there are actual brain findings with after three vomits.
Gotcha.
But
With the diagnosis, you mentioned that there's varying grades of concussion. Is the diagnosis uniform across the NCAA, whether it's volleyball or soccer or football? And then is it uniform from the NCAA to the pro level?
no, there's a lot of variability.
Okay. Talk about the NCAA first then. It's not if they're in a concussion protocol or someone they're checking them out at halftime in the middle of a game for volleyball versus football, is it not the same test?
So no, it doesn't. It's not, and I feel like there are a lot of variables there. Process is one, as we've talked about processes. So those might all be regulated, but motivations, who they're evaluating at halftime, and who the evaluator is are definitely, and how reliable, how much is an athlete advocating for themselves, because some of these things are self-reported, right? So like if I could be super dizzy right now and not tell you that I'm dizzy, but if and if you ask me, I could say no, I am not dizzy, or I am super dizzy. So there's a lot of variability on what's being reported. Yeah, you wouldn't know if I'm seeing double right now,
Sure.
right? But so, or if I'm in pain right now, you might see me grimace. So I think that there's a lot of variability. What we do know is that the majority of people on the sidelines are getting just extraocular motor testing, like look left, look right, um, where are you, what's your name. We know that that's not adequate testing, and that it definitely involves and more than that, and it should involve more than that. Sometimes, though, that doesn't happen until days to weeks after, and if it's bad enough that someone's getting carted off the field, it might happen sooner. But the reality is really that there's an underreporting problem, an advocacy problem. There's definitely a recognition problem, and there are a lot of biases that go into who is being evaluated. And I think that's at NCAA and pro level.
So for any kid that they finally make it on the field, and then they get hurt, the last thing they want to say is, "Hey, take me off the field. They've been waiting that long." And if you're at even with the NIL deals now, there's more money involved. At the pro level, there's even more money. So if they're off the field, they might miss bonuses and they're not going to play. Someone else comes in and takes their spot. Nobody ever wants to leave the field because of an injury because they're worried that the person behind them is going to take their spot. So the obvious pressure internally is don't report, don't self-report, hold it all in, whether it's a concussion or maybe you broke your finger. You're right, I broke my finger, but I could still tackle, right? So you're not going to mention that until later. You can get it said afterwards, so there's all those cross currents which impact the truthfulness and it makes it hard to evaluate and then make, treat and address it.
Yeah. So speaking to that, though, I think people don't know necessarily the consequences of an injured brain.
Hmm.
And so we know that playing with a concussion increases their risk of a musculoskeletal injury by 50%.
What exactly does that mean
So,
there, Doc?
yeah, so that means that if you're playing with a concussion, um, or with concussion symptoms, that your risk of a bone, tendon, soft tissue, ligament injury, one that you might be casted for, that you would really be noticeable to other people, increases by 50%.
Mm.
So then, then you are at risk for tearing your Achilles. Then you are at risk for, um, you know, um, radial fracture, tibial fracture, or shoulder problem, or a bicep tear. You're much more at risk of something like that happening if you play with an injured brain. The other thing that I tell my athletes too is if you don't report and you are playing a team sport, people are not going to know that they are going to expect the same level of performance. And you will want that, but maybe your first step won't be as fast. Maybe you won't jump as high. Maybe your judgment or executive functioning won't be as high. So while there is money on the line, while there's scholarships on the line, all of these things, you are not going to be able to perform at the best of your ability. And that leads to a much more, detrimental consequence, I think, is then your team doesn't win the championship. Then your team, you're exposing other people on your team to injury, or you are at risk to yourself too. So those are kind of the conversations I would have. People, it's definitely easier to recognize a broken bone, um, and much less obvious when your brain is injured. But there are definitely still consequences.
All right, let's talk about the fix. Days, weeks, months, medicine versus not medicine, your behaviors. How do you fix your brain as quickly as possible?
Yeah, I think that's the whole motivation for the concussion program that I started here at Mizzou, is to recognize as early as possible to be able to intervene and develop a customized plan of care, as early as possible to get people back to the level of activity that they're used to as quickly and safely as possible. Right? So recognize as early as possible, intervene, and then get people back to their sport, their activity. So, and I think that is physically as well as cognitively. I'm received an SEC grant. I'm going to be going to Alabama. They really beat us hard in football, so I'm going to have to go with like my hat in hand, when I go. But to establish better return to learn protocols for our college athletes, that have been concussed. So it is very important to consider learning and cognition as well. But uh, the methodology is really get in quick. So access is important. We try to see people, for example, within a week or two. And if you don't have that kind of access, you try to learn about a program near you that you can get evaluated at. Then people think that it's just time, right? And then previous literature was about cocooning or isolating until your brain is recovered. And really, it's now as early as possible start introducing regular activities, again, cognitive and physical. So we tend to order PT, so physical therapy, occupational therapy, speech therapy, right off the bat. Those services do 1 hour assessments on everybody and determine a customized like plan of care for every patient they see. What does this person need versus this person? Um, and that's dependent on their baseline skill level, their baseline activities. So, if you have, and I have a lot of baseball players that have gotten injured, they will think they're all fine. Then they will get to the batting, they'll go to batting practice, and they're like, my hand-eye coordination is totally off. And so then we will do physical therapy specific for their needs on hand-eye coordination or batting. And so really the awesome thing about PTOT speech, here speech therapy does cognitive therapy too, working on that judgment, working on the decision making, working on memory and retention. What would be worse than an key athlete getting concussed, going onto the field, forgetting the plays?
Mm.
Their coach is calling out a play and they're like, I don't really know what that is. And that is something that we've seen. I saw that in a patient a few days ago. And they were like, I need to come out because of that reason alone. So PTOT speech, neuropsychology. So neuropsychology evaluations are super important in many different neurologic conditions, but it gives us the lay of the land, right? So where is your visual memory? Where is your calculation memory? Where is your mental health stored? And what areas have been injured, and what can you do as a patient, I do as your physician, and your physical occupational speech therapist do to strengthen areas that have been weakened. It will say, for example, that someone has underlying ADD, ADHD, now they've gotten concussed and now their focus is more of a problem. Or there's underlying depression or anxiety. Now they've gotten concussed and that is now much, much worse. So then as a physician, my job would be, let me optimize my treatment of their depression and anxiety, give them the tools that they need. And then we do things like use medication if needed to help mitigate or to like address their headaches or sleep, or mental health, or preferably 2 to 3 of those birds with one stone.
Gotcha. So
And then,
good.
sorry, and then being an athlete, I definitely ask about nutrition, and their supplement use. So creatine has a place in brain recovery. Magnesium, greens and reds, just a good solid balanced diet can be super helpful in recovery too. So we talk about supplements and where do we have space to add on.
So I'm not trying to simplify or trivialize how smart you are and what you just said, but as a coach and meathead, is this an oversimplification? If I want to be the best athlete I can and I'm building myself mentally and physically, we need to do all these things, and your brain decides what to do, right? So it's all about the brain, whether it's your knowledge or your mindset. But if sleep is huge for me to recover and it helps your brain recover, I got to think adding more quality sleep would help me with a concussion. If nutrition is important as an athlete, I got to think eating well would be impactful. Neurologically, you said playing a different sport. Well, maybe if I'm doing some other activities that helps build those pathways, might help my brain, and just being smarter. So athletes that play chess or do Sudoku or are always reading, being a smarter person helps your brain get better. Maybe if I'm concussed and I start doing some of those things, it could help it heal as well. Is that an oversimplification, or am I way off here?
No, I think that's right. I think that what you're saying is um, a holistic approach to brain recovery, and sleep. Mental health is a huge one too because that guides
Mm-hmm.
mindset, right? So if I have a concussed athlete or a person who has no motivation, is depressed, is anxious, doesn't want to get back onto the field or something like that, and we work on a progression to optimize their mental health, whether it's medication or a slow transition back into that activity, then it helps to guide their motivation to keep wanting to do it. right? To not isolate themselves from their sport totally. So, and I would also add that I think it's oftentimes multidisciplinary. So what, you mentioned sleep and nutrition. I think it needs to be all of those at the same
Mm-hmm.
time. So one evaluation isn't going to be just talking about your sleep. It's going to be talking about your sleep, your pain, your mental health, your movement, and your memory. And so we have to make sure that we're not losing ground and we're not losing time by not addressing all of those altogether. But absolutely, I think finding the most problematic areas, what is important for your lifestyle, your activity, your job, your sport is important, and then fortifying that, strengthening that, adding to it, um, finding the gaps and filling them, I think is super important.
Well, we talked about what it is and what happens and how you treat it. I gotta believe you have one or two or three. Now your brain's weaker and weaker, getting damaged more and more. At what point do you have the conversation, and how does that go when you say, "Hey, dude, enough's probably enough here"? How do you guys go about that?
So I think being an athlete myself, uh, my sport and my ability to play my sport, I take very personally. I had a mildly torn bicep, and someone who's not an athlete told me, you just need to stop doing your activity. And I was like, no, I have a competition in a month. You're going to get me ready for
Right.
that. So, really, I think that it's a very personal thing. I think people need to make informed decisions. They need to understand the risk of of the decisions that they make, and my job is to try to help them to think about those things. So I ask people, patients, and like the actual athlete or their caregivers, their parents, coaches, if they're there, to ask and reflect on a few different questions. One is, how much do you love something? How good are you at it?
Mm-hmm.
And what is you think your hope for your future is in it, right? So I think passion and love drives your coachability and your
Mm-hmm.
teachability. And so if you don't love something, and someone who is passionate about it, your coach is telling you to do something, you're going to be like, I don't really care to do this, and you're going to laissez-faire, half-ass something, and then you're going to expose yourself to injury. If you are not good at it, then it doesn't matter how much coaching you get,
Mm-hmm.
you still might not be better about it, better. You might not take the header on soccer the right way because you're not being coached, because you haven't developed that skill set yet. So I think that's important. Also to really help figure out, what the risk assessment is. What is your future in this? If it's like, I just want to play the next game and then I'm done, they're like, you're already playing injured. Like, is it worth, and you play a guard, or you're on the line for football, is it really worth exposing yourself to at least five different injuries? And I had one parent, actually two interesting conversations that I would share. One is, early in the football season, a parent was like, when we sign up for something, we stay, we are accountable, we follow through. And I was like, yes, but he doesn't want to play. And if he doesn't want to play, he's not going to apply himself to learn the skills properly to protect himself. And is it really worth playing if he doesn't even want to play and he's now playing a sport that actually causes injury? The other parent I remember talking to, he was like, well, he's fine for 5 seconds at a time. A play is just 5 seconds. I was like, yeah, but a lot can happen in these 5 seconds. That's how he got injured the first time. So, it's not about your endurance in those times, it's what you're doing in those 5 seconds. So, really evaluating those three things, I think, is important. And then whatever the decision is, I 100% fully support as long as there is informed decision making and reflection on those questions. Um, I also counsel my athletes that if you are playing a sport or involved in an activity that increases your risk of a head injury just by doing it and participating, then I suggest that you make good decisions in other areas of your life so that it mitigates and lessens the risk over here of injuries happening to your brain so that you can withstand better, you can withstand more injuries on the other side. So for example, don't roughhouse on hardwood floor and on concrete, or jump from a really tall tree, or wear your seatbelt, wear your helmet. Don't drink excessively. Don't get in bar fights. Don't speed through stoplights. Like, live a safer, life over here. Make better decisions so that you can play the sport that you love, tolerate some more injury perhaps, and then just be more successful playing it if you are really love something. So if that makes sense.
Yeah, yes. We talked about it a little bit before, and one of my nerd backgrounds is in finance and investments, and my crude way of summarizing is the return on investment for an athlete. So, is the return that they get their identity, they love it, that there's a return value there, or is there a return that they're going to play and they make an impact? So, wins and losses, so there's a return value. Then there's the return of, financial gain. And then the investment is all the work you put in and the cost other than the work of, injury or pain. And you talk about there's also investments outside of the sport. And if you're playing rugby and hockey and wrestling, all three big collision sports, you know, the overall risk of your portfolio of your life is high. And if you can minimize some of that in some areas and just have one area be high, then your risk overall is much lower and you can still maintain the one thing that you love the most. So it is about mitigating some of that and handling it. But once they know, they make a decision, then you move forward and you embrace it. And that's kind of just the way it goes. Um, Man, lots we can keep going on and on here, Doc, and I'm having a great time. So we'll just run through this at the end. I like to wrap some things up, just kind of just get some more, flavor and feel for who you are. If you're lifting, what do you listen to?
Hmm. I listen to a lot of Dorothy, and I listen to just, I mean, pretty simple workout music. Um, Unfortunately, my Pandora or my Spotify comes with commercials, but usually I have this playlist that's hardcore sweat sesh, and so that's what I'll listen to. A lot of Dorothy, like I said.
Nice. What's an adventure you haven't done yet that you want to do still?
Oh, I love to hike. I want to hike Patagonia or
Mm.
Chile, South America.
You have a favorite sports movie?
I have several. I love Cool Runnings. I've reflected on this since I wrote on there. So Cool Runnings is just quotable. Love it. Karate
Mm.
Kid is also good. It's kind of cliche, but I like Remember the Titans. Probably it's just a good pulls at your heartstrings on some points. So um, I actually, my favorite series is the 30 for
Oh yeah,
30s.
that's really good
Um,
ones
so
there.
I Yeah, I love a good sports documentary, and I think all of those were really really interesting. So really am a sucker for those.
You got a favorite athlete in sport to watch?
So I used to really enjoy watching Jordan when he played in
Oh, me too.
basketball. Um, I I think tennis, watching Roger Federer play, the guy was humble, as you had mentioned. I think he like had amazing skills, just all around great person and athlete, I thought. So
Awesome.
Roger Federer, I think, was fun to
Yeah, Hall of
watch.
Famers. It's not hard. What's your favorite book to read?
So I think the most productive, probably book that I would recommend to everybody would be Crucial
Mm,
Conversations. I think it's important in any field to be able to have a difficult conversation, and it also helps mindset and change the narrative, not make up a narrative, but actually have a productive conversation. I think what you're searching for is my unofficial, non-politically correct book, which is probably a variation of 50 Shades of Grey or something like that.
gotcha.
So,
Yeah, I see that big smile over there. Uh, you have a favorite superhero or villain? It could be real or fictional, real life person or not. I don't really care, but a hero or villain that you like?
um, so villain, I think, was best done by Heath
Mm,
Ledger as the Joker in Batman: The Dark
yep.
Knight. He was very, very good, embodied that really, really well. So he was an excellent. In fact, I use a clip from uh, one of his scenes to exemplify pseudobulbar affect after a concussion. So the laughing, excessively crying, anger outbursts, that's a injury to the frontal lobes called pseudobulbar affect. So anyway, so he would probably be the villain. Superhero, I mean, I think Batman is quintessential superhero of choice. I was in conversation with coaches at one point, and we were talking about different Marvel characters, and I think the Wasp is also of one that I was most like I personified the most, maybe, um, and I liked that. So
I like.
probably Batman, and if I was thinking about myself, probably the
Okay.
Wasp.
What's your favorite lift?
Um, Deadlift comes more naturally. It's easier to think about, just walk up to the barbell, pick it up. I used to love that the most, and now squat is tied with
Mm,
that because I've had to actually really work on my squat depth and engaging my lats and pulling down on the bar. And it's definitely not perfect yet, and spreading my toes out, and on all of those. But I've strengthened my squat, and so that's definitely tied with deadlift now. So I like deadlift and squat. Easily hate bench.
mm, hate.
Yeah, I dislike strong work.
Dang. Dang. You got a favorite quote?
Um, I yes, I like Man in the
Mm-hmm.
Arena. That was, I think, a Theodore
Yep,
Roosevelt
for
quote.
sure.
So it's more than a quote, maybe, but it's I love that. And then I love Ralph Waldo Emerson's The Definition of Success.
Yeah,
So those are two of my favorite.
those are
Um,
big. And Emerson's
yeah,
all about, things beyond just competition, but how you make an impact in your life and those around you. So that's huge. Man, great time today, Doc. Where can people get a hold of you, whether it's at Missouri or wherever else? Where can they find you?
well, I'm often in the gym. I'm often here at Mizzou. I have a Facebook account. I have an Instagram account. Um, I have a LinkedIn account. I'm on, if you search, University of Missouri faculty or Department of Neurology, or if you search Komal Ashraf in Columbia, I'll I'll come up on that. Um, but yeah, I think under Instagram, my handle is my first name and my last name. LinkedIn as well, my first name and my last name. And Facebook is Como, and then my maiden name Shah,
Gotcha.
Shah.
Man, I learned a lot today. I was real excited because I had all these questions I can feed back to other coaches and parents and athletes. So, thank you for the time and the gift of your knowledge and your generosity. So, learned a lot. For those that are following along at home, send us questions to info@athlete-builder.com. And be on the lookout. My book is out there for pre-order. You can get it the week of Thanksgiving, but you can pre-order it now at Barnes & Noble, Amazon. And it's Athlete Builder, the blueprint to build champion athletes. So, hey, Doc, man, great having you on today. Thanks so much, and really appreciate it. It was really great.
Yeah, I had so much fun, Jim. Thank you so much for having me. And I really hope that we together keep impacting the athletic world.
For
So
sure. All right, take care.
thanks. You too.